Yeah, let me hope you are doing well. Yeah, welcome to my YouTube channel. Yeah, for those who subscribe, thanks for subscription. Those ones who have not subscribed yet, yeah, subscribe, click the bell, put on the notification, and we continue to learn as we enjoy. So today we are going to look at menorrhagia. What is menorrhagia? In simple terms, it's excessive bleeding during menstruation, excessive menstrual bleeding. But medically, we use the term menorrhagia. So today, we're going to look at the common causes of this syndrome. We're going to look at home remedies we can use to treat it. We're going to look at the medications we can use to treat this condition. First of all, menorrhagia can be due to some causes which are not related to any disease, such as what we call hormonal imbalances. So when the lady has hormonal imbalance, the endometrium or the inner lining of the uterus is going to thicken. And once it thickens, by the time she's going to menstruate, she's going to have a heavy load. Because remember, when they are menstruating, they are shedding off this uterine lining. So once it is thickened, they are going to have a load to shed. So they will end up having a heavy menstrual bleeding. Two, we have IUDs. Yeah, intrauterine devices. Sometimes they bring this. It can be either a Mirena or a Paragard. So they have it as their side effect. So it's one of the side effects of the intrauterine devices. So if you are using intrauterine devices, you have higher chances of having heavy menstruation or heavy menstrual bleeding. There is what we call medication side effects. Some of the medication we use, they bring side effects which include heavy menstrual bleeding, such as contraceptives and other medications. So it can be as a side effect of a drug. So another issue, what we can look at, it is what we call emotional stress. Yeah, when the person is overstressed, this stimulates your brain receptors to stimulate some, stimulate the pituitary gland to secrete hormones, which hormones are going to come and affect your uterine lining and disrupt your menstrual bleeding. So this will also lead you to have heavy menses. Yeah, another one is having uterine deformities such as uterine cancer and cervical cancer, having uterine polyps, having fibroids. Fibroids, there is a video I uploaded about fibroids. It is there, you can go and view it. Yeah, it's talking about fibroids, their causes and the different types of fibroids. So when you have a collection of all these uterine malformities and some issues, will lead you to have what we call menorrhagia or excessive bleeding. So there are other causes which can also bring this. There are other causes which can also bring this. So now, what home remedies do we use? Before we go there, how do I measure that? How do I know that I'm having menorrhagia? The normal volume, we expect a lady to shed maximally 60 milliliters of blood. 60 milliliters of blood. But once it exceeds 6 milliliters, going to 90 milliliters to 80 milliliters of blood, it means that you're shedding excessive blood. And this one can expose you to many other factors which are life-threatening. And these factors, there is anemia. So when you are shedding a lot of blood for a prolonged period of time, you can easily get anemia. And it's life-threatening because you can die. So how do we treat them? What are the home remedies do we use? What do I need to eat when I'm in my periods so that I avoid menorrhagia? One of them is what we call when you are in your periods, you have to regulate taking lemon juice. Yeah, we say lemon juice. There is apple cider vinegar. It can also help you. Yeah, you can include fibers, mostly vegetables in your diet. They can also help you to regulate your periods. Taking warm water is also of a greater benefit in regulating your menstrual period. So, what are the drugs do we use in this case? One of them, we can use a hormone intrauterine device, such as Mirena. It can work, which is a progestin releasing intrauterine device. Then we can use oral progesterone. We can use oral contraceptives. They can also help to regulate the amount of blood you're shedding when you are in your menstrual periods. Other drugs include tranexamic acid, which causes thrombosis of veins, collapsing of veins, the uterine veins. They collapse so that the blood you're shedding is minimized. Once the veins collapse, it means that there is minimal blood that you're going to lose. Then there is what we call non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs such as ibuprofen and others, they can also help you to regulate the amount of blood you are shedding. And at the end of it all, you are going to control this condition termed as menorrhagia. At the end of it all, you're not going to be losing a lot of blood. So once you see signs and symptoms of having excessive bleeding, you have to switch to these remedies, to switch to these drugs, so that you control it as early as possible. Because we saw it can lead you to death by causing anemia and the other related issues. It can easily lead you to infertility and many other indications it can come along with. Yeah. Thanks for watching. Subscribe.